and show you and demonstrate it, to be honest with you. We've got a couple of ways of testing for that. And again, same thing, therapy, they'll have a trot bursitis, calm that bursa down, so again, ultrasound, guided injection, etc. They're all things that we can do, again, all conservative. And sure enough, yes, we can always throw some surgery at them if they're really resistant. And all that involves is just basically making when I say a hole, you make an H incision in the iliotibial band. That gives a bit of space for the great trochanter to actually move through, but you still maintain the integrity of the IT band, which is what you want to do. Cutting straight across it to make the thing to do. But would you believe there are people that do that? So, so that's your snapping hip. And then somebody with an eye, can I get you to go actually on the side? So just to kind of show you a bit of that. So lateral position, we're going to bring the hip into extension, ideally, and you hold the leg, and quite simply, you just put your hand on top of their GT, and then you can literally roll them around one way or the other, and you can feel it literally pinging under your fingers, which they'll recognise. Somebody asked me in the last group, well, if they have a snap and it's not painful, would you do anything about it? And kind of my answer is, well, no, I personally wouldn't. I just want to, you know, maybe do everything we can do to stretch them out, but wouldn't necessarily want to do anything. If it's painful for them and a problem, well, yeah, okay, then we can start going down that route of doing things. But obviously, hopefully, you know, we want to try and avoid surgery. Ober's test is just an IT band test. Quite simply, it's a hip extension. As you know, somebody with a really tight IT band, bring them out to hip extension. And when you try and drop their knees down, either extension or even a certain amount of flexion, one, that's uncomfortable. Two, their knees just won't meet because they're so stretched out. They've got a really bad, tight IT band. So again, treatment for that, as you know, you've got to do all your work, foam rolling them, etc., and then treating the sore bits. And usually you find it's not just IT band, it's a bunch of other structures with it as well. So look at the hamstrings, etc., and make sure they're nice and loose. And then as for SIJ, have you guys done this? You should. I think you're covering this in spine. Have you done spine yet? No. Okay, you are covering, but very quickly. Faber, as I've mentioned, I'll jump piriformis, so I'll come back to that. Stalk test. The stalk is, so you stand behind the patient, get them to stand on the affected leg, so they lift their other leg out of the way. And then you put your hand on their SI joint and you get them to extend, hyperextend back, and that should be uncomfortable for them if they've got an SI problem. Your other route is, again, lateral position. You kind of do this stretched out Faber. So again, you kind of take them right the way over and get their leg right the way over the other side and force it down. Funny enough, that hurts as well. So, but that's, you know, SI pathology, but I think Monty's going to tell you all about that. Piriformis. Okay, now piriformis is a contentious subject. You're either a believer or you're not. So, you know, people talk about, okay, can you palpate it? I think it's pretty tough to palpate right on the piriformis. We've got other ways of isolating it. How about maybe doing a little bit of something in terms of trying to palpate it whilst we do a muscle test? So the best muscle test for it is, again, our hip flexion 90, knee at 90, and doing resisted external rotation maneuver. So that way is external rotation. Okay, right. And and all I'm going to do is, so you're going to try and do that, and I'm going to stop you. So I'm going to put my hand on that side and hold it here. So you go for it, fine, and I'm going to stop you. So, and then what you can do, it's quite not easy because you need three hands here, but because you're trying to hold them here while you're resisting their external rotation, if you can get your fingers on their alleged piriformis, then that can help you with the diagnosis, supposedly. Personally, I'm not really convinced you can really totally isolate piriformis, to be really honest with you, but it's there. Fine, that's that bit of special tests. And then muscle testing, got loads of them. What you want to think of there is, we're trying to test, 4 zones. So hip flexion, hip abduction, adduction, and then hip internal and external rotation, and then hip extension. So in flexion, it's rather like our resisted straight leg raise maneuver. So if you hold your leg there, I'm going to get you lifted up. So push up against my hands. So that's a quad test. And then we bend the knee, and then push up against my hand here, and that's a psoas test. You could do psoas test sitting down, for example, with them attempting to lift their leg up. So they might be sitting like so, and then you're going to resist their hip flexion to come up like that. Then from, again, supine or lateral, you're going to do adduction, abduction. So again, just resisted, so they're going to take their leg across one way and then the other way. And then same for the internal external rotation. So supine, 90-90, as I say. And then again, just that resisted internal external. And then finally, we'll spin you over to prone. Can I just get you in prone? And this is just hamstring glute testing. So hammy is just, again, if you just lift your whole leg up against my hand here, so I'm going to push him down. And then our glute, you can bend the knee, lift up. Can you lift your back of your leg up against me? And that's more of a glute. Now, I kind of think this is, the hamstring glute axis is really important, and I think it's important that you get your patient, if you have got a patient with hip issues, then they all tend to be very tight. They've got tight hams, tight ITs. They tend to be very hamstring dominant. They'll be firing their hamstrings before they're firing their glutes. It's really important to try and get them to be glute dominant over hamstring. And then, thanks, turn over. And so one little exercise is actually just getting them to try and fire their glute before they're firing their hamstring, and learning that process, and trying to apply that process to whenever they're trying to do their glute exercises. Because we want them to be glute dominant, and that's really critical. Because as you know, glute centers the ball in the socket, hamstring going out front. So there are all our muscle tests. You okay? Is there anyone? Does anyone want me to? Does that all make sense? Anyone confused by that? No? Okay, fine. So let's all. I'm done on the exam actually. Let's all sit down. I think we've probably still got about 10 minutes to go.